Hey, thanks for joining me. Be sure to like our page, subscribe, check us out on Facebook at Master Your Practice, and go to our website, masteryourpractice.com, for free resources. Remember to like and subscribe. Bye for now. So, you have to do the things in your office to practice safely. That's number one. Now, what's number two? Well, you have to communicate these safety measures, because if you don't, patients won't know. They want to know. So, 3 messages. We're open. Your safety comes first. And here's what we're doing to ensure it. That must be said over and over. You've got to send this out in different communications. It has to be done by email. It's got to be done when you do your phone, when you have the phone calls. It's got to be done, virtually everything you do in your practice. You have to do it in signage, and your team needs to have scripts they can say to patients. Look, this is serious business. So we have to protect our patients. We can't do that, we can't practice. So it's been a rough few months. We're going back, albeit slowly, and it's now time to hunker down and get this done. Now, this is a crisis, there's no doubt. But if you communicate, there's real gold in the moment. Because honestly, many of your colleagues won't communicate as much as they should. Doesn't mean they're bad people, it just means they don't communicate as much as they should. And there's communication gold in how you handle all this. So I want you to make sure that you handle this crisis. This is the Chinese symbol for crisis, which is also great opportunity because it's a combination of symbols. But make sure that your team is ready, that your practice is ready, that you communicate to your patients. And now let's look at this from the standpoint of how you can turn this crisis into an opportunity. And you absolutely can. So, lean into the wind. This may look like something from Wizard of Oz. It's a storm. The winds are blowing. It's a tough time. And still, it is the right time to do what you can do to take care of people and to also promote into this storm. Now look, there's a concept, and this is an important concept for you to get. And here it is. Share of voice equals share of market share of voice equals share of mind equals share of market. It's a voice, mind, market. Voice, mind, market. Voice, mind, market. Voice, mind, market. Now, why am I saying that so many times? Because when there's not many people talking, they can hear you. And right now, many dental practices aren't saying much. So it's a perfect time for you to say a lot. It's a perfect time for you to do so. It's a perfect time to promote into it. But you have to, what are you going to promote? That's a different talk. That's a different conversation. So let's lean into the wind, if you will, so that you can be prosperous. But it's also the time to reform your practice better into a model that you like and want. The one that will serve you well, and serve your patients well, and serve your team well. The truth is, the better off you're doing, the more you can serve your patients. So you have an obligation, literally a moral obligation, to have a successful practice. You know, many years ago, in the Old West, there were these men in wagons, men and females in wagons, but they rode from town to town selling stuff because it wasn't a general store. So when they would come along, they would beat a drum. Thus the term drum up business. But if they couldn't sell from an empty wagon, so I want to make sure that your wagon is full so you can be prosperous and help the people you should help. Remember, you have 2 jobs. Deliver fine clinical care. Absolutely. This is expected. It is the thing that patients say, well, I hope so. I hope you will. I think you should. Of course you should. But it's also a second thing, is to build the practice that does it. build the practice machine and the systems so that you can grow and be prosperous. This is the great neglected. Look, dentists are, and you may include yourself, I'm assuming you're a dentist, but are artists and scientists, number one. So promoting ourselves, growing our practice may not come naturally. We can help you, promise. But understand that while you're delivering care, if you get these other pieces out of place, you're not going to be successful. Let's talk about what these other pieces are. Number one is getting new ones. In fact, 93% of all dentists say that's the number one problem, is getting new patients. What do you inherently think when you hear that? You think that's right? I don't. Okay, obviously we have to get patients to say yes to our suggested treatment. Then we have to deliver it, and deliver it well, and deliver it with a great customer experience. But then we've got these other pieces. Keeping the patients. A lot of practices lose patients. Or they don't have their patients come back on a regular basis. So, and their net result for patients is they don't do as well. Their mouths aren't healthy. And right now, immune systems need to be stronger than they have ever been. So, treating patients on a regular basis to keep those mouths clean, prevent periodontal disease, or treat it if it's an issue right now, is more important than ever. We know that the comorbidities, the comorbidities that, boy, we just went crazy there, didn't we? I apologize. The comorbidities involved with COVID-19 are such that the less healthy they are, the more likely they are to have a problem and to have a mortality rate, not just the comorbidity. So we know obesity, heart disease, diabetes, and age, and a decreased ability to fight infection are all increase the chances of falling ill and actually dying from this disease. So, the more that we keep them healthy, the better off we are. So, the thing I'm trying to tell you about, though, is these other pieces of the puzzle. These other pieces of the puzzle are keeping them in the practice. That's where we started here, this fourth sphere of practice, handling finance and money. Right now, when we're talking about reforming the practice, we have to be careful about personnel. The ADA has told us in a report they provided to the profession, they had economists give 4 different projections about what's possible in the coming times related to the recovery. None of those projections said dentistry is going to come back to the level it was before the COVID virus. So what does that mean to you? Is you have to operate differently. You have to be cognizant of your expenses. You have to increase your leadership. You have to be aware how important your people are. In fact, this may be the best time for you to invoke this one rule that I think is one of the best rules you can possibly have. What is that rule? That rule is, knowing what you know now, would you hire that person again? If you wouldn't, I suggest they should find another economic opportunity, and you find someone who's better suited to your practice philosophy, and has a greater talent. Basically, it's hiring more A players to work with you. This 7 spheres is really critical. Yes, you have to get new ones. Yes, you have to get them to say yes. And you've got to deliver. But if these other pieces aren't there, you're in trouble. I noticed this just when I was teaching doctors just how to market better, get more new patients, and get more patients to say yes, and they sometimes would go up and stay and others did not. The diagnosis of why they wouldn't is because these other spheres were out of whack. That's why. That's a simple reason. So, understand that a lot of your profitability is in keeping those 7 spheres going and in place. Really, it's been sloppy business practice that has allowed corporate dentistry to grow. And boy, has it grown. It's grown like crazy and will continue to do so. The chances are more and more dentists are going to take this time to exit the field and say, I'm done. Well, I suggest to you that we should adopt some of the practices this corporate dentistry has adopted if you want to improve your profitability. One quick and dirty. This is a really easy way to look at it. What's your equation of productivity and profit per team member? Large corporations, large companies have very big numbers. So a typical Fortune 500 company will have somewhere in the $400,000 to $500,000 in gross revenue per employee. Did you know that? Most small businesses aren't anywhere close to that. They're more in the $120,000 to maybe $164,000 per employee. What does that tell you? It tells you we need to get better at how we run teams, how we train them, and how they perform. Another conversation for another time. But understand, if you improve the practice business, the business of practice, you can also become much better as a clinician. And that first came to me when I studied with L.D. Pankey. And I'm old enough to have studied with him and sat with him and talked with him at length about philosophy of care. For those of you who don't know who he was a dentist philosopher. He was very important to my development, and I think a number of other dentists. But here's the thing. It doesn't have to be sloppy. There's this frame of mind. If I get really good at running the business of my practice, it means I'm not going to be as good a clinician. There's nothing further from the truth. You just have to give it a balance. Plus, your peace of mind that occurs when you improve the business of your practice is awesome. So, it's time for your practice renaissance. It's when is a better time? Now is the best time that you can possibly have to have a practice renaissance. Shape it, form it like you want it. Where you have the lifestyle, the profitability, the enjoyment of practice on a daily basis, the way you want to have it. It all is within those 7 spheres. It's in leading the practice. It's about setting the goals. It's about doing all those things. I can help you whether you need it. Now look, there's also another concept that I hate. When I heard it, I hated it. I still don't like it. I've learned to accept it to be true. I didn't like it. So, what was that? What that was and is that this phrase, what got you here won't get you there. Now, this isn't applied just to dentistry. It applies to every business. What got you here won't get you there. Now, what does that mean? It means what you understand about your business, about people, about human nature, about promotion, about finance, about keeping patients, the patient experience, all those things. You got up to a certain point. But all of that has to grow. It all has to increase for you to be as successful as you want to be. I didn't like this. The thing is, you have to understand, how much harder can you work? Now look, you've had a big vacation, a forced one, but really, when you were practicing, how much harder could you work? Was working harder going to do it for you? And of course, you hear working smarter. Well, yeah, it is. It's really working different. And most guys, gals, don't know what that means. So they don't have a place to go. And it's training you're not getting. I didn't get inside the profession. I went outside the profession to get it. And that's what I think. That's why I do what I do when I do with coaching. Is to help guys get from where they are, where they want to go. Because they have to add things. And, I saw something today, a phrase. It says, most people want to change without changing. They want the success of the change without really changing what they're doing. Unfortunately, that's not the way it works. I wish it was the way it worked. It just doesn't work that way. So what do you got to do? You've got to operate in a way that realize that you have to continue to learn and grow, just like your team does. So, important point, what got you here won't get you there. So, what do you do now?